Urine is a waste product that is produced in the kidneys as they clean the blood. It is then collected in the bladder. Urine contains chemicals that your body does not need and can be harmful if it moves from the bladder back to the kidneys. It is important to empty the urine from the bladder regularly, 4 to 6 times a day as appropriate, depending on your fluid intake, diet, and medication. Take your time to ensure that the bladder is emptied completely each time you empty your bladder. If urine is retained in the bladder, it may cause an infection of the urinary tract. In this video, you will learn step by step how to empty your bladder. It is relatively simple, but will require some practice. Start by washing your hands thoroughly with soap and water. Remember to wash your thumbs. Make sure you have all the supplies ready before you begin catheterization. You will need an appropriately sized catheter. You will also need soap with a neutral pH value, moist towelettes, and perhaps a mirror fastened to your thigh. On the back of the package, remove the round adhesive cover from the adhesive tab and attach the package to a clean surface. The pouch should hang vertically in an area that can be easily reached. Open the upper end of the package by pulling the ring towards you and then downwards. To avoid spilling the liquid from the pouch, peel only until you see the entire colored funnel. Arrange your clothes so that you can move freely when doing the catheterization. If you can, always try to urinate on your own before using your catheter. To prevent bacteria from entering into the urethra and bladder during catheterization, first clean the area around the urethra properly with soap and water or moist towelettes. Cleaning the urethra may be easier for you if you fasten a mirror to your thigh. Spread the labia apart and wash the opening of the urethra. Wash from front to back to prevent the transfer of bacteria. Use each moist towelette only once. Continue to hold the labia apart. Remove the catheter from the pouch. The first 2 inches below the funnel are uncoated, so it's easier for you to hold. Make sure the catheter does not touch anything before you insert it into the urethra. If it comes into contact with surfaces, it should be discarded and a new catheter must be used. Touching a sink, clothes, or skin, for example, will contaminate the catheter and could potentially cause infection. It is important that you relax to make the insertion of the catheter as easy as possible. Slowly and gently insert the catheter into your urethra. Be sure to use gentle movements and remember, if you touch an unwashed area with the catheter, it is recommended you use a new catheter. Insert the catheter until it reaches your bladder and urine begins to flow. Then insert the catheter about 1 inch further and hold it there until urine stops flowing. When the urine stops, slowly begin to withdraw the catheter. To ensure complete emptying of the bladder when using a catheter with a straight tip, it is recommended that you slightly rotate the catheter as you withdraw it and stop each time more urine drains out. You can dispose of the catheter and the packaging in a trash container. Do not flush it down the toilet. Wash your hands again and the process is now complete. Important note: the catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to advice you have already been given.